I would like to invite Dr. Nidhi. She will speak about unsatisfied patients after EDOF, and after that we'll have a very interesting session on case-based choices. Yes, over to Dr. Nidhi.
Thank you. Good morning, everyone. My topic is, are there any unsatisfied patients after EDOF? Is it even possible? So this is one of the most recent studies on this, which studied whether there is a dissatisfaction after implantation of extended depth of focus intraocular lenses. Out of 202 patients, even minor dissatisfaction was noted. So almost 52 patients had some kind of complaints. And out of these, the most important complaint was a blurred vision and other was photic phenomena. Most important take-home away point I'm telling in the first slide is that residual ametropia was the responsible for 50% of the causes. Apart from that, 25% problems were because of the dry eye. And in this study, it was found PCO, minor PCO was also found to be one of the causes. So if we go from the front, as Dr. Sean told, that preoperative evaluation is the most important, including the preoperative counseling. So if there is a wrong patient selection, like for example, if the patient wants a very good near vision and you are selecting a low power ad EDOF, of course the patient may express dissatisfaction after the surgery. Patient expectation need to be handled and complete ocular examination of the cornea and retina needs to be done. Intraoperative factors, if there is any surgical complication, it can also affect the results, and centration issues, as it has been mentioned earlier, it can affect especially in refractive EDOFs like VVT. Then of course, post-operative factor, most important reason for dissatisfaction is residual refractive error, including astigmatism. Then dysphotopsia and contrast sensitivity issues, we have to tell that although it is significantly less compared to the trifocals and bifocals, still there can be some issues. In fact, in most of the studies, it has been shown around 10% do have mild dysphotopsias. Then of course, there can be minor PCOs. So preoperatively set the expectation, do a complete examination, accurate biometry. Another way to look at this is the patients who are having dissatisfaction at distance vision. So they can complain of fluctuating vision, which is mostly suggestive of ocular surface disease. And of course, residual refractive error, which can also cause dissatisfaction at near. And low power EDOF, as mentioned earlier, can also cause dissatisfaction in near vision. So the option depend upon the cause. If the reason is ocular surface disease, we treat with lubricants, punctal occlusion treatment, and meibomian gland disease treatment. If there is PCO, you do YAG capsulotomy. If there is residual error, either you can suggest glasses, or there is an option of mini monovision in the other eye, or there is an option always of the LASIK or PRK, and a last option is of the lens exchange. In the later case also, the patient counseling and reassurance can always help in case of dysphotopsia. In one of the studies, this is also one of the recent studies, which was done for assessing the risk factors of the dissatisfied patients for the presbyopia correcting intraocular lenses after cataract surgery. And in this, it was found that for the dissatisfaction for the near vision in EDOF lenses, it was found that the major risk factor was preoperative myopia, as it was just mentioned by Dr. Nitin. And even less than minus 0.5 of the myopia, these patients can be dissatisfied after EDOF lenses if they have not been counseled that their near vision might not be that good. So we need to counsel these patients appropriately. Now, in the end, I'll just show a case which we faced recently. There was a fellow who had passed out from our institute, and he messaged this to the group that he had a -1 refractive surprise in a patient of Alcon VVT, and he complained of blur vision and shadow, and near he was accepting +2.5. So we asked him to do the complete examination, and then this was found that the lens appears slightly decentered. And if you can notice in the surgery, what was the problem? So he was very sure that he had put the lens in the bag, but after re-evaluating it, then he realized that actually one of the haptics was in the sulcus. And the problem was solved after redialing the lens in the bag. So the main take-home away point is that keep your mind open. Just because we are putting a EDOF or a multifocal lens doesn't mean that the problem will be associated always with the lens. All other factors of patient dissatisfaction after cataract surgery needs to be evaluated with an open mind. So, and again the take-home point is residual refractive error and ocular surface conditions and dysphotopsia and minor cases PCO. These are the major causes of dissatisfaction after premium lenses including EDOF. Thank you.
Thank you, Dr. Nidhi. And